Okay, so this is the treatment I really wanted to show for sciatica and radiculopathy, which means pain radiating on the leg emanating from the lower back. This is what I really wanted to show people because there's a lot of treatments out there, but I am absolutely confident, especially with what it did to me. We actually started doing the videos doing what's called linear decompression or traction, which was a weighted machine which uses straps and a pulley system. It's real standard in therapies, practices, physical therapy, chiropractic offices for lower back pain and specifically sciatica and disc problems. This treatment, however, it's so minimal, it's so, light and non-aggressive that if you're actually, some people say, well, I'm terrified to get my back worked done. If you're terrified of this, you're probably terrified of puppy dogs, something, because this is not aggressive. This is so light. It's actually so relieving, especially if you have sciatica. It's a shame this isn't used more often. It's a technique. It's called Flexion distraction. Michelle's going to kind of demonstrate it. It uses gentle pushing with the leg on the side that it's affected. And let me tell you, it just provides so much relief. It's just wonderful. It's a lifesaver, godsend to me, to be honest with you, because as 3 weeks ago, when I first made that video, I was extremely terrified of what was going to happen. I didn't know, and the staff here can actually explain. I was in terrible, terrible condition, but I'm literally 85, 90, if not percent more better, sleeping with no pain. And it's really due to the flexion distraction and a lot of the work that Michelle did with the sacrum and all stuff that we do in this office. So she's going to kind of go over this just a little bit. Go ahead, Michelle, if you want to start it just a little bit. And you'll notice it's, that's it. I mean, she just repetitively opens up the lower back. There's joints in the lower back that are kind of opened up, and it's such a light force, and it's so relieving. I could do this all day, but the reality is it only needs to be done for a few reps, a few sets worth, and it's amazing. I don't even have any pain in the leg. It actually feels tremendous on the lower back. Feels great. Can't even talk. And people with sciatica get just tremendous relief off of this treatment. What it's doing is essentially the way where the anatomy is with the nerves and discs in the lower back. It kind of stretches the disc in such a gentle and light fashion. It kind of pulls it away and gives the nerve root that's coming into the leg from the spine just enough relief that I'm not even able to talk right now because it feels so good. It pulls it just enough that it decompresses the nerve away from the disc, decompresses the disc. And she just finished one set. We're going to do a couple more sets like that. And that's going to be it. But that is the extent of the treatment. And people go through a lot. There's really no need for people to suffer with sciatica, radicular leg pain. No need at all when you can do something as gentle and non-aggressive as this, what you just saw. And that's the extent of it. And given a time, and like I said, I'm on my third week, and I'm 95% better. A lot of people end up getting, not knowing any better, end up getting epidural injections, sent to the neurosurgeon with suggestions of possible neurosurgery, and end up on painkillers or exhaustive physical therapy. When in reality, this is it can be treated a lot quicker than that, and much more gentle. Does it happen every time? No, but happens a lot? Yes. When it doesn't happen, we would refer out to a neurosurgeon or orthopedist. But if this gives relief like it did to me, which happens often that we see, there's really no need. And people within weeks, like myself, are generally doing a lot better, you know. So if you haven't had it done, I highly recommend you get checked out by a flexion extraction practitioner. And if you're local here, we're at Macomb Chiropractic, and if you have sciatic symptoms or know somebody who has stuff similar to that, have them come by and check it out. It'll be a lifesaver, and if it's like me, it'll definitely turn things around in a real positive, easy way. So, thanks.